Welcome back to part two with Dr. Kimberly Mallett, who has brought us a wealth of knowledge around alcohol. So, Kim, let's talk about
Yes.
alcohol and sleep. What is the
Yes.
deal with alcohol and sleep?
It is not helpful, but it's deceiving. So I think it's misleading, and people get a false sense that alcohol can be helpful with sleep, but it really um, isn't. And that's that again. It just lures us in and plays a mean trick on us. Is what it's doing.
Well, you said in the last episode that you had some research of your own. Did that have to do with sleep?
So anecdotal research for
Oh,
me, yes.
okay.
Okay.
So for me, so I check all your boxes, right? So I'm late 40s. I'm going to hold on to that as long as I can. I'm late 40s, and but sleep is I think challenging for so many reasons as
Mm-hmm.
we age. But alcohol um, isn't helpful, and I think where people are going to be surprised is in a couple areas. One, we know that if I think anyone who's ever gotten intoxicated recognizes you're not going to get a good night of sleep if you've been drunk.
Mm-hmm.
That no one wakes up feeling refreshed after a night of
Right.
heavy drinking. So that's no surprise. But what sometimes people start to fall in the trap of is thinking, oh, just a glass of wine or a drink it helps kind of make me tired and relax me and prepares me for sleep. So alcohol does have that sedative effect, and it will do that for you. But the problem is once you get to sleep, the quality of your sleep turns to crap. So, just to basically lay it out there. So what it does, I'm going to try to kind of to simplify this so it's not too nerdy and sciency. But during the first half of the night, when we have alcohol in our, so it's in our system now, what it does is it's going to increase our slow wave sleep, and it's going to suppress our REM sleep. So when we're sleeping, we cycle through all of these stages of sleep throughout the night. So people will wake up and think, oh, I had a dream. You didn't just have one dream. That's just the dream you had most recent to waking up. You dream all throughout the night. You have different periods of sleep, lighter and deeper waves of sleep. So alcohol is disrupting that full night of sleep. So in that first half, that's what happens. But then you metabolize. Remember, your liver's working while you're sleeping. And once the alcohol leaves the system, the sedative effects diminish. So how many of us have woken up like 2,
Every
3
night.
in the morning? And it's not just going to be alcohol that's responsible for this, but it definitely can play a role here. And especially for people who are sensitive to it. So if you're waking up in the night, and this is when it becomes challenging. So you're having these sleep disruptions, and these become more frequent. I did last time we talked, I talked about alcohol's a toxin, right? It now it can also destroy some of the neurons and impair them permanent. This can, after prolonged use, if this is a pattern where a lot of drinking is happening at night over a sustained period of time, it can permanently damage some of these neurons responsible for our sleep cycles, change our entire architecture of sleep. And what can happen is when people then try to abstain and think, okay, I'm going to stop drinking, the sleep problems don't get better because, well, sometimes they're just not going to. And then they go back. It's easy to fall back into the pattern of, I just need to get to sleep, so I'm going to have a drink. to kind of knock me out and sedate me.
This is what I do, but with melatonin.
Yeah, well, so yeah, I'm a melatonin junkie myself. So I have my own drugs of choice these days, and those would be like melatonin and estrogen and all
Yeah.
sorts of
Oh, good. All the black market drugs. I mean, it's so hard though, because women in this perimenopause phase, like sleep already goes down out the window. Like it already just is really rough for a
Yeah.
lot of women. And so you tackle on alcohol and it's like double whammy.
Exactly.
And it's so hard to function the next day. And then we know that from a body composition phase, it doesn't help us either. And then we don't have energy to go to the gym. Like it just is this like roll on effect of all these other issues that kind of contribute to it. What do you think of like drinking in the day? Clearly it messes up the night's sleep. But if you were like, well, I'm going to have 3 drinks this week, that's going to be my negotiation.
I think if you want to drink and you can get it as far away from your bedtime as possible, that's better. So think about it from a harm reduction approach. If you don't want it to impact your sleep, metabolize it out before you go to sleep. You don't want to go right up against bedtime.
So how long is that? 4 hours?
2?
5 hours?
No, well, it depends how much you
I'm
drink.
like, so
the
5
rule
minutes?
of
What?
the rule of thumb is an hour per
Okay.
drink to process. So, if
Okay.
you want to have a glass or 2 of wine, just think about when you're going to bed and give yourself. So timing is everything, right? How long does it take you to drink a glass of wine? And you get kind of in the weeds about like, when did I start? When did I finish? And how well is my liver functioning? Depending on my age, as we age, our liver is not as efficient.
So do we need to add 30 extra minutes?
Yeah. So if you want to
Yeah.
cushion it. If you want to be conservative, great. But you think about, well, maybe there's a reason happy hour is a thing because it's earlier in the night.
Yeah.
And I think really what it is knowing your limits. So it's this idea of, can you just have a glass of wine or one cocktail and be done? Or, maybe you're out, maybe it's a weekend, you're at a party, have a couple of drinks, be done. There's always going to be an occasion where maybe it's not the norm, and that's okay. It's one episode isn't going to be a deal breaker, but it's more that consistent pattern that I think we need to be aware of what we're doing. What's our habit? What's our daily pattern looking like?
Interesting.
So what exactly is a drinking problem? What's considered, if you want to talk about like habits and
What's AUD?
Yeah.
What qualifies? So it's changed, and it's funny. A lot of times, I think our nomenclature, our vernacular, is an alcoholic is kind of what we describe, and that's what we use. But really, there's no such thing in the diagnostic world. So it's really based more on a continuum, and when we look at a diagnosis of an AUD, there are 11 different criteria, and these are a mixture of different things of the impact alcohol is having on your life from a social perspective, interpersonal, your daily functioning responsibilities, and our physical dependency on it. So if you endorse, after going through a clinical interview and assessment, if you endorse 2 or more of these issues, and those could be things like, this is causing a problem between me and family member, loved one, spouse, you're missing out, you're not able to maintain responsibilities, work, school, those types of things. I think the big ones that I really take note of is if you are struggling with limiting your alcohol intake. So, for example, you are trying to have you're setting out to have a couple drinks and you're at a party and you just blow right through it and you're to the point of intoxication. And every time you start drinking, you just really can't stop, limiting or always kind of going beyond what limits you're setting for yourself. If you're craving, if you're noticing that you're having withdrawal symptoms, like you get the shakes, if you need it, if you're feeling really irritable, if you don't have it, these are those types of physical dependency symptoms that come into play. So once we start seeing those are in that realm of severe, and that's when we need to talk about more serious treatment and intervention. When people are starting to say, "Hey, I'm worried about you," you're just starting to notice that your tolerance, I think is a big one that people really just don't understand. They think, "Oh, tolerance means that you need more alcohol to get the same effect." So a lot of people take that to mean it's, "Oh, I can handle my alcohol well. I don't get sloppy, I can drink." And they see it as a positive thing. It's really a big warning sign, because your body's adapting to try to manage the amount of alcohol, and you're not seeing the effects. So you're not seeing the balance issues, the slurring, the judgment. Your body's starting to compensate. But what that means is you're not actually interpreting how intoxicated you are. So your BAC is still the same. If you were to drink 4 drinks and feel really intoxicated, but you maintain that, and then you were to drink 4 drinks and not feel that as much anymore, people make a lot of errors. They think that they can drive, but your BAC is still what it would have been before. You're just not feeling the effects of it.
Can you back up and say, since we did this is the second episode, just clarify what AUD stands for and BAC?
AUD is alcohol use disorder. Okay. So that would be like the diagnosis of having an alcohol problem.
So AUD is the technical term, but the public says alcoholism or an alcoholic. Okay.
Mm-hmm. Mm-hmm. And BAC is blood alcohol concentration. So that's something I think most people associate with that 0.08 level to legally, once we cross that threshold, we shouldn't be driving. That's when we're impaired. But the BAC has a huge range. So when we start to notice difficulty with just judgment, when we start to notice we have physical symptoms, so our reaction time isn't as good. And this is why it's 0.08, because that's around the time where reaction time, all of these things our brain is just doing automatically can't do anymore, because alcohol is a toxin and it's a central nervous system depressant, and it's doing all these things in our brain. So it's making it harder.
0.08? Like, what does that end up being? Like 1 drink?
No,
I know it's probably different per like weight, how much somebody weighs.
Yes. That's why it's so important to actually pay attention to these, what NIAAA puts out. You can find them online. They're BAC charts where you can enter your weight, your gender, the amount of alcohol, and the time taken to drink, and it will give you an estimate of what your BAC would be. Wow. Because how we feel is not an accurate estimate because of things like tolerance. And so even though you may feel like alcohol isn't, that you're not really experiencing a lot of the impact of alcohol, your BAC is still the same as what it was before tolerance increased. So it still impacts those subtle things like reaction time. You're still not safe to drive a car. And if you got pulled over and you blew in a breathalyzer, you would potentially be over that legal limit.
Laura, I have a question for you. Oh, go ahead, Kim.
No, go ahead.
did you, I mean, I'm sure Kim's read plenty about this, but I just had the fertility just came to mind. When you like it, does this play into fertility when you were in that
Yeah,
world?
when I went through all the rounds of IVF and yeah, infertility, they don't want you to drink when you're going through IVF, and it affects it.
You
Yeah.
probably already knew that, Kim.
Well, I'm not sure of all the reasons, but I know, again, it's never going to help anything, right? It's not something that's going to make our fertility. It's not going to improve our physiological state or any of these health benefits. There's just that's not what alcohol does.
But doesn't it do something for the male, like for sperm?
I actually don't know
For the
that. I'm just assuming our body functions better when we don't have drugs and alcohol in our system, right? So it's like if we
Exactly.
want our bodies to
mic
function
drop.
the way it needs to, then, and if
Yeah,
you're really working towards a goal like that and you're spending all of this time and money and supplements and medications, you don't want to do anything that is going to be contradictive to that.
exactly. Yeah. So I think that's a key piece. So with alcohol use disorder, I mean, there are a lot of variety of things that can come into play, but it's the key here is once it hits that severe point where physical dependency comes in, the way we deal with it is very
Mm.
different. And that means you are now in a world of where you pass the point of where you can drink moderately or light again. You
Mhm.
can't just go back to being a social drinker. There's just this
Mhm.
flip that, or the switch that's flipped in our brain. And that's where that limiting comes in. And it's just this internal struggle that happens. So even people that may not have been um, physically dependent, but felt like they really kind of struggled with their relationship with alcohol, that I've worked with have kind of made a decision at some point to say, I think I'm going to choose just not to drink because it's easier for me to do
Mhm.
that. I don't like having to constantly struggle with myself. And I think we can all relate to that. Some people think about sugar or think about something that dietary that we like. If we Some people can just have a little bit of chocolate every day. I know you do that, Haley, and you're good.
Sure
You're
do.
satiated, you stop. Some people, if they have a little bit, it makes them want
Mhm.
more. And
Mhm.
then there's this constant struggle, and they seem to not crave it as much if they don't have it at all.
Yeah.
So it's really about knowing your body. And I think that's a good analogy. If we've talked a lot about alcohol, how should we treat it? Well, I kind of think about it maybe as like cake. Like, how often do you eat cake? Do you eat cake every day? Probably not. And if you do you eat the whole cake or just have a little piece of cake? And can we equate that to our relationship with alcohol?
Yeah, that's a good analogy. You said in part one that a lot of your work has also been around ways to prevent someone from having AUD. What have you found has worked the best, especially with these kids that are going off to college or that are in college? What has been the most effective?
So I can talk about some of our intervention work and I do a lot of etiological work where I identify risk factors for coming into college and being a heavier drinker, experiencing more consequences. And we've also done a lot of work with parent developed and tested and randomized clinical trials, parent based interventions, and how parents can make a difference in their kids' life. So, just some general risk factors. So, we want to be very aware of risk factors and some that we can manage behaviorally. There are certain ones we can and certain ones we can't. So for example, family history would be a risk factor. Well, we can't really change
Mm-mm.
that, right? But we can be aware of it. And once we know if we have that risk factor, when we talk to young adults or teens or parents are talking with them, it's important to kind of point these risk factors out, and that it's important that how to make decisions about alcohol. The second is age of onset. So we know that the younger you are when you start drinking, the more at risk you are for developing risky drinking patterns potentially, and then going into adulthood with those. So the longer we can delay that, the better. The average drinking age or modal drinking age is about 16 in the States. And in other countries, you have no idea how much I hear about, well, what about Europe? They let their
Oh,
kids
yeah.
drink. And I'll talk about that in a second, because we've done trials and I've published work on this very topic. Um, the one thing that parents can do, the most important thing parents can do to lower their kids' risk of going into college and being a heavy drinker, to protect, the most protective thing is to not be permissive. Do not give your kids alcohol, even tastes. Like what we're finding is that permissiveness to drink, and this was actually surprising to us. This is a little bit counterintuitive, but when you allow your kids to drink, even in small doses, they may be really responsible when they're with you, but that's not going to necessarily translate to when they're in a college environment. And that environment is so, so different than being at home with your parents. It doesn't matter if you're the best communicator, if you monitor your kids' behavior, if you model good behavior, and we want you to do all those things, right? Those are all good. If you do all those and you are permissive and say, oh, yeah, you can have a glass of wine because it's a holiday or a wedding, or you can have a taste of this or that, that basically makes everything, it counters all the good stuff you're doing.
I would not have thought of that. I would have thought it was the opposite, where it's like it's not so taboo. But that's funny that you say that, because I just had a conversation with one of our friends last weekend, and she was like, "Well, like all the 16-year-olds, all these parents, will just rent a party bus for prom, and they're just like, well, at least they're safe and they're going to be doing it
Yeah.
anyways." No, don't do it, parents.
Yeah.
Okay.
Yeah, the research would say do not do that. There's never, and people will say, well, what about Europe and this and that? Well, in Europe, their kids start initiating around 14, and they have much higher rates of alcohol use disorder.
Wow.
In Europe. Yeah. So no, and this research is consistent, because we have colleagues all over the world that, in the Netherlands, we've talked about this with permissiveness. All the data are consistent here across studies, and our own studies, other studies coming out of other labs, other parts of the world. Permissiveness is not protective. This idea of, well, at least we know where they are, they're drinking at home, or they're not going to drive, it's not protective.
That's interesting.
It's putting the kids at higher risk.
Laura, like now you
I
can,
know.
you have all this information for raising kids
I
that
know.
we didn't
I was
have.
actually talking to my sister about this the other day. Like, how do you have your kids have a healthy relationship with alcohol where it's not taboo? It's not, because kids want to do what they don't want to do or what they're told not to do. Right. So I'm happy to know this.
Wow. Is it the same with sex? Like parents that have, again, same friend that was like, oh, and there's just like a condom drawer at one of the friends' house. This was new to me. I never experienced any of these things,
No,
but
I don't know that. I don't know about its translation. And I do want to give a caveat here, where if your kid So I think there's a way in which you handle the permissiveness issue. So if your teen, so say your high school teen is living at home and goes out, you get a call from said teen saying, I can't drive. I'm stuck at this place. I need a ride. Of course, you go make sure your kid
Yeah.
is safe. It's not saying, be militant. And I can talk about some other research because there's this line, right, about being rigid, authoritarian type of parent, where I said, don't do this because I said so, rather than authoritative, who says, don't do this, but here's why. And having conversations with your kid about your rationale and your reasoning because you care about them. There's a very big difference between how that pans out with alcohol use. The because I said so puts kids more at risk. The authoritative who says, I'm not going to allow you to drink because your brain's still developing until you're in your 20s. Alcohol hurts that. It's not safe. It increases your risk of having problems with alcohol. Alcohol is really not a safe substance. And I care about you and I love you. And so I'm doing this because it's in your best interest. So that's a very different communication style.
I was raised in number
Yeah.
one household.
Yeah. But that authoritative or that number two style is much more protective, and it gets the message across because you want your kids to understand how to make good decisions about alcohol for themselves. So helping them with the decision-making process and understanding the risk around alcohol is so important so they can make good decisions for themselves. But that being said, you make sure your kid's safe. You go pick them up from the party. You don't say, no, I said don't drink, so you're on your own. You don't want to be militant. But then the next day, the conversation gets revisited of, I know we talked about not drinking, and I'm glad you called me, and I appreciate that, but we need to have another conversation about you drinking because you're underage. And that really goes up. I think what we found is this idea of not being permissive until they're 21. But I work in a world of a huge college town. We see all sorts of things happen. I mean, football is a huge deal, tailgating, and you see a variety of things happening, like kids drinking with their parents that are underage, and just all sorts of behaviors that parents, I think, are always well-intentioned and want to do what's best for their kids, but they just don't have the data to understand that long-term impact. And so we actually did a study where we did a Zoom call. It was an intervention with the parents where we talked about this very idea of permissiveness, talked to them about their family rules and what impact this had on the risk for their kids as their kids were about to start their freshman year at Penn State before they brought them in. And what we found was this short intervention quickly, it reinforced parents who were not permissive, which is good. And then it actually, within a short 15-minute conversation, switched parents' perception of this and their intentions about permissiveness very quickly. And now we've looked at how it translates to what happens when the kids are in college. And so we looked at it in the short term, like their first and second year, and we saw positive benefits of this intervention. So we have now submitted a continuation of this study that's under review to start looking at AUD issues as these students are graduating and going into adulthood. So we're looking at, can parents actually be protective in preventing AUD from developing, or these high risk behaviors from potentially leading into AUD.
When is that research going to come out? In a few years? I'm so interested to
No,
know.
well, the data on the parents we're already analyzing and writing up, but the continuation to actually track these students long term to see the long term effects of this parent intervention that we'll know more about in the next year, 6 months to a year. But we're tracking them just because we want to keep them in the sample, so we hopefully get the funding and then can follow them to look at these bigger, more chronic issues, and can we prevent those from developing by using parents.
What is the most interesting or surprising fact or data that you have found in your 30 years of research dealing with alcohol? Doesn't have to be with college kids, like anything that you can think
Oh,
of.
I mean, just to name one of them is this idea of permissiveness, that if parents are permissive, it basically takes over, and it just wipes out the beneficial effects of all the other good parenting behaviors that we encourage and are so important. I'd say a couple things were surprising, and some are pretty simple. But in my college student work, I look primarily at consequences that people report experiencing. And one study I did, I asked them, how negative was this? Because as researchers and clinicians, we always just call these negative consequences. And what I'm referring to are things like vomiting, blacking out, hangovers, having regretted sexual experiences, and so I asked this question because what I noticed in previous work that was also surprising is when you asked people who experienced these things, how much would you have to drink to have it happen again? They would say more than what they drank the last time it happened. So they weren't curbing their behavior. They weren't learning from their mistakes, so to speak, right? They weren't saying, "Oh, that happened. I don't want that to happen again." And we make this assumption that these negative consequences are aversive, right? And that people, when they experience them, are going to think, "Oh, okay, I'm going to be careful next time, or drink less." Well, they're not. They'd actually, and heavier drinkers just blew through it. Like they kept drinking more. So I asked a simple question, and when people would report consequences, I'd ask how positive or negative was this experience. And you'd be shocked that a lot of people rate these consequences as neutral and sometimes even positive. And we're talking about blackouts.
Wow.
Blackouts are another like tolerance is kind of misunderstood. So are blackouts. Blackouts is when we drink, usually they happen at around a BAC of 0.3 or so, depending on your tolerance level. If you have a higher tolerance, they're going to take longer to kick in. But it's when you've had so much alcohol that your brain has to now make a decision: keep you alive by breathing or make memories.
Oh my gosh.
And it shuts down your ability to make memories. You're still completely functional. Like you're still walking, breathing, doing stuff. It's not passing out. It's just you're not creating, you're not able to remember what happened the night before. That's a big deal.
That is.
But they don't see it as so much a negative. Some people do, but some people don't. And again, people who don't see negative consequences, researchers' negative consequences as negative or aversive, are less likely to want to avoid them, right? So then they drink more and this cycle starts going.
Okay, that was totally news to me. It's incredible how the body will take over despite what we try to be like, we can trick it. And you can't. And it will just keep doing its best to keep you alive.
Yeah, and that's alcohol poisoning is a very real thing. So even at lower levels, like 0.3, but between 0.3 and to 0.4, it can kill you. You will die. That's alcohol poisoning, where it shuts down your ability to, your brain can't function. It can't keep you alive. It can't breathe. Your respiratory system.
So it can be a lower amount than what you really think, is what I'm getting from that comment also.
It depends on the person. So,
Well, for someone who
and
is an
again,
over drinker and consistently over and over again.
yeah. So, but their tolerance is going
Yeah.
to go up. So their body gets better.
Mhm.
So tolerance is really your body trying to protect itself, right? It's trying to continue to function and keep you safe and alive, even though you're drinking. So it's trying to adapt to the amount of alcohol. So if you're a heavy drinker and you're maintaining that over time, your body's going to try to
Mhm.
get better at managing the side effects, those depressant effects.
Mm.
So general adaptation syndrome that happens with everything.
Yeah.
Well, this is no
So,
different.
but you can reset tolerance. So if you stop drinking, even we get it at lower levels too. If you think about just having a glass or two of wine, you may not notice it hits you as much if you're drinking consistently. But say you do dry January and then you have a glass of wine in February, you may think, oh, whew, that just hit me a little bit
Mhm.
more than it used to. That's because you don't have tolerance anymore. Your tolerance went back down to baseline.
I'm kind of curious about what is going to happen if this pendulum swings the other way, and if we find a new way to a pill or something. I know those things are already out there, but it seems like we're as humans, it's hard to really give up something that we really like. So we
Yes.
just find another way that could be.
Yeah. So, this idea of, well, how can we what can we do to reduce our alcohol use? And when I start working with someone who uses alcohol to cope or has it in their life, for it's there for a reason. So you don't just take it
Mhm.
away, just say, okay, just stop drinking. That's why people just don't stop drinking, because they don't have anything healthy to replace it.
Yeah.
So what can take the place of alcohol that's healthy? And in our life in general, we want to think about exercise, social support, therapy, finding other ways to manage stress if alcohol has become the go-to. So if you're feeling stressed, maybe going for a walk or starting to practice different mindfulness skills, starting to do things that take the place and manage your stress in a healthy way so that you don't feel like you need it as much.
Mm.
And those would be tips for someone who is listening and thinking, you know what, I think I am drinking too much and I would like to take it away, like not drink anymore in my life.
Or just reduce it. Drink for more social or celebratory reasons, not drink because I've had a hard day.
Mm. I think that's that wrapping it up. That is something that I try, and you're you're going to be in the course too. Um, but the negotiating with yourself that we talked about in the behavior change module about, maybe pulling back and being like, okay, well, maybe I won't have one drink every night, but instead of it's also hard too, because you want every woman to have a place and not feel kind of ostracized if she's like, well, I'm not going to, give up alcohol
Right.
completely. And that's okay. That's an individual decision that you have to
Absolutely.
weigh the risk versus the reward, maybe the timing, if you want to help, with sleep. I think it's kind of great that there's a lot of talk about circadian rhythm.
Mm-hmm.
And when we talk about circadian rhythm and eating around
Mhm.
that window, naturally, if we put alcohol in there, then 2 to 3 hours before we go to bed, we're done eating, we're done drinking, and it just sets us up. I mean, I don't know. It's
Yeah.
kind of interesting how it naturally, from the beginning of time, the rhythm that we normally had, and now we're swinging right back to the very basics.
Yes. Yeah. But again, it's not that if someone chooses to drink or has a glass of wine every day, doesn't mean that there's something wrong or a problem, but it's really about a whole big picture. If someone feels like, okay, I'm thinking about this a little bit too much, or I'm planning things around my drinking, just you kind of get a sense of when it stops being optional or when it becomes too much of a habit and you want to check in on it. But some people just really like the taste of it, and I get that. I like it too. I like a glass of wine. So what I often recommend is focus on quality rather than quantity. And this is where mindful eating comes in. If you're going to have a glass of wine, get a good one. Enjoy it. If you're going to have a cocktail, get a nice cocktail and really enjoy the taste. Try to slow down your drinking so a drink lasts longer. Sometimes people are really fast drinkers. If you can find a beverage that, like red wine isn't cold, you're not trying to drink it before the fizz runs out. If you can find something that you can sip and savor, it makes it last a little bit longer, and maybe you're going to have one drink instead of two. So just those types of negotiating skills can be helpful as a method of reduction, because we know the less we drink, the better it is for us.
All I can hear is my mom growing up saying, Haley, moderation in all things.
Which is true. Yeah. Mindful eating, mindful drinking.
Thanks, Mom.
Yeah.
Yeah.
I actually appreciate that you're this expert in this space and you enjoy a glass of wine, because it makes it not this shameful thing when you talk about it. You can have a great relationship with it. It doesn't have to be this negative, horrible thing. It's just being thoughtful about it.
It is
intentional.
Yeah. So it's being intentional. Exactly. Intentional. And you decide when you have a glass of wine. The glass of wine doesn't decide when you have it. So it's knowing that relationship. And don't get me wrong. I mean, the 40s was a time where I'm like, I'm going to join some wine clubs, because the quality over quantity was so important. If I'm going to have a glass of wine, I'd rather have a really good one and have fewer. And that's just kind of a choice that I
Amen,
made.
Kim. I love that.
Amen. Don't you want Kim to be
yes,
your
I'm like,
therapist?
what should we talk about?
She's been mine unofficially. She's talked me off the ledge multiple times since I started my business. Haley, okay, let's break it down. And I'm like, I'm quitting.
Well, I'm glad you didn't. I'm glad you stuck with it, Haley. And I think so many other women are too.
Oh boy. Well, thank you so much for your time, Kim. I'm so thrilled to know you personally and just for what you give back, to everyone really. But I love the female data too, that you're just researching, but you're also helping on the therapy side as well. Like, you're just a well-rounded, amazing person. And I'm super grateful that I know you. So thank you for joining us.
Thank you for
On the
having
Body
me.
Pod.
Thanks, Kim.
Season 3. Thanks for listening.
If you enjoyed this episode, please consider giving us a 5-star review and sharing the Body Pod with your friends.
Until next time.